Alright, we're good to go.
Okay. Hi, we're here today to talk about bloodborne pathogens. And bloodborne pathogens is one of the areas that belongs to OSHA. And OSHA is a federal branch, and it works with employees, making sure that employees are safe in their work environment. The bloodborne pathogen standard was started many years ago, and it was started to help protect healthcare workers. Unfortunately, many healthcare workers have lost their lives due to bloodborne pathogens. So a standard was needed so that there would be a basic level of safety for employees, and it encompasses quite a few different things, and that's what we're going to talk about today. The bloodborne pathogen standard prescribes that safeguards to protect workers against health hazards from exposure to blood and other potentially infectious materials, and to reduce their risk from this exposure. Who's covered by this standard is anyone that has any exposure to blood or bodily fluids. Some staff have more exposure than other people. In therapy, your exposure is there. It's not as much as, say, a housekeeper or a nurse, but it's there with the things that you do, the clients that you work with on a daily basis. And so it's important that you understand the different components of this standard. Exposure occurs when you're exposed to blood and bodily fluids, and that there's an exposure in some sort of orifice. So for instance, if you weren't wearing gloves and you were taking care of somebody and somehow were exposed to blood or bodily fluids in which bloodborne pathogens can be transmitted, that's when this standard comes into place. So the whole piece with the bloodborne pathogen standard is really to protect yourself against that transmission. So we have a standard level of protection, and then in addition, when that bloodborne pathogen exposure happens, that we have a plan to handle that exposure. There's quite a few. The number one area is needle stick injuries in terms of bloodborne pathogen injuries, and that hopefully wouldn't happen within the therapy department. But just so you know, there was a needle stick act that's part of the bloodborne pathogen standard, in which it's important that anyone using needles really has some input into the type of needle that they're using, and that those needles, of course, have safeguards in them. We can go.
Do you want me to? I can't really see it, so.
Oh, you can't.
Yeah, so.
You want me to? Okay, I'll have
Or
to. I'll have
is it
to.
even helpful that you have this, or since you have your slides?
But, maybe I should just be going off this instead of this.
It's the same, so.
It's the same thing.
Because it looks fine, like you can kind of see your papers anyways, and occasionally looking down and you're looking up, so it doesn't.
Okay, so it works okay?
Yeah.
Okay,
so
then
I
let's
think-
just, we'll go without
Yeah.
it then. Okay.
Okay.
This standard applies to all employees in a general industry where there could possibly be exposure, but really specifies the folks that are going to be at a higher risk. So for instance, in a facility, a receptionist certainly has the potential to be exposed to blood and bodily fluids. However, that exposure is just occasional. It's not happening on an ongoing basis. So that person would be at a lower risk than, say, you as a therapist or a nurse or a housekeeper. All staff, whether you're part-time, temporary, or full-time, are treated the same, though, because your work is the same, and that's what's looked at. In terms of definitions, the bloodborne pathogen defines blood as meaning human blood components and products made from human blood, and those could be plasma, platelets, and those other types of things. Otherwise, and also medications that are derived from that blood. Bloodborne pathogens are those microorganisms that are within the blood that can cause disease. And there's a whole host of bloodborne pathogens. The ones that we talk about most of course, are hepatitis B, hepatitis C, and HIV, but there's a whole host of other bloodborne pathogens in addition to that. So the rule of thumb is anytime you have an exposure, of course, to bring that forward so that we can check into it. Make sure that we get to the root cause of it so that we can try to delete that from happening to anyone else, and then, of course, to get care for the person that's been exposed. Contaminated means the presence or the reasonably anticipated presence of blood or other infectious materials on a item or surface. And then decontamination means having the right product to decontaminate a surface. And that's very, very important. We'll talk about that later in this video. An exposure incident is, like I talked about before, it's a time when you're exposed to blood or bodily fluids and it comes into contact with non-intact skin or some sort of orifice or surface on your body. Non-intact skin can be skin where there's abrasions, hangnails, cuts, those types of things. So very, very important if you have any open areas at all. Or this season, it's winter right now, a lot of hangnails, that you are wearing gloves to protect yourself. Let's go down to, there's a lot of other definitions, but everybody can get this, so it's no problem. Engineering controls are putting into place controls so that you're going to protect a person. So an engineering control on a needle would be the safety shield that we now have. And there's engineering controls on a lot of different things. In the area of therapy, probably not so much as in working with direct patient care on the nursing floors. And needles, I would say, IVs, those types of things, lancets are the #1 areas where we have engineering controls. An exposure control plan, and Augustana has an exposure control plan, is a whole plan on how we're going to try to hopefully make safer the work environment and have those engineering controls in place. Each facility, and then as an organization, we have an exposure control plan, and you're welcome to take a look at that. That is available. Exposure determination is when we go ahead and determine how much exposure that a particular person has, as I talked about before. And there's a whole section in the exposure control plan where we go about doing that. Universal precautions is a standard that is, of course, across infection control and also is really, really important in the bloodborne pathogen standard. The universal precautions means that when you're caring for a client or a patient or a resident, that you consider them to have a bloodborne pathogen of some kind or another, so that you always protect yourself against blood and bodily fluids. And I always say whatever procedure you're doing, that you should dress for the worst case scenario. And so, keeping all of that in mind, we have available gloves, gowns, masks, goggles, all of those types of things, so that if you're involved in a situation where there's a possibility of exposure to blood and bodily fluids, that you can put those types of things in place. Important that when you're wearing gloves, that you're wearing gloves that work well for you, that you're able to manipulate your hands in a good way, and also that they fit correctly. We have gloves that are small, medium, and large, and just use whatever glove is best for you. Engineering control examples of what we have available in our facilities are sharps containers, of course, needles with shields, those types of things. Work practice controls that we have are, of course, ensuring that everybody's washing their hands after doing any sort of work with residents and before working with another resident, using gloves as you need to. Also, if you are exposed, that you wash your hands or whatever area as soon as possible. After use, making sure that sharps are placed into a sharps container. That we never recap needles. And I'm telling you some of this so that if you would see it in your work environment, that you would talk to the nurse or the housekeeper or the team that you're working with, so that the supervisor can get involved for more education. We all have to work together to try to decrease bloodborne pathogen exposure. Other work practice controls that we have are that we don't want to eat or drink, apply lip balm or anything like that, contact solution in the workplace. All of those types of things increase the potential for exposure to bloodborne pathogens. If you're keeping food and drink on a floor or in an area, make sure that there aren't any, and this is going to sound a little bit gross, but there aren't any specimens or any sort of medications or anything like that in that same refrigerator. The refrigerator for food and fluid should be separate from anything else, and of course should be temped so that we're sure that all of that is safe. Personal protective equipment is available, as I discussed before, and just make sure that you have that and that it fits. Gloves can be worn when it can be reasonably anticipated the employee may have hand contact with blood, other infectious material, mucous membranes, non-intact skin, if we do any IV sticks, that sort of thing, or touch any contaminated surface. And there's a whole host of, as I talked about before, information about gloves and other personal protective equipment. In terms of housekeeping, which is another workplace control, we want to make sure that we're using the right disinfectant, the right product on our surfaces to make sure that we're killing bloodborne pathogens or potential bloodborne pathogens. Each of the pathogens has a life cycle that's very, very different. So for instance, HIV tends to, outside the human body, not live very long. I think it's maybe half an hour, something like that. Whereas the hepatitis B bug can live for a very long time, even close to a month. Another pathogen that's not bloodborne but just occurs that we work with in healthcare, C. diff, can live up to 3 months. So you want to make sure that you're using a disinfectant on your therapy equipment, on your tables, everywhere that's actually going to kill these bugs. In order to do that, therapy would need to really take a look at the efficacy sheet of that particular disinfectant and make sure that you're using that disinfectant for the right period of time. Important to read the directions. Remember that there's a difference between cleaning and disinfecting. Cleaning, you're just cleaning off a surface. Disinfecting, you're usually spraying something on a surface and you need to leave it to dry itself for a certain period of time, and each product is a little bit different. Most often 10 to 15 minutes. If you wipe it off ahead of time, you're not getting the full effect of that particular disinfectant. That's part of the whole bloodborne pathogen scenario, so that we're sure that the areas that we work in and that we have residents in are very, very clean. There is a listing in terms of therapy of the times that you, I'm saying this, we'll have to add something in here, but that all of the different things that you use within therapy are cleaned. So make sure that you pay attention to that. The other area in housekeeping that you should be aware of is that there is some regulated waste. And regulated waste is anything that's blood or bodily fluid saturated. And those types of products, so say somebody is in therapy, they fall, and there's a lot of blood, you would wipe that blood up with a blood spill kit, which you should have, and then you're going to need to put those products in a red bag, which signifies that it's regulated waste, and then that red bag should go into a biohazardous container. Find out from each facility that you're working with where those red cans are. Most often in a utility room or that type of thing, but so that you make sure that you throw those away, because that just alerts the housekeeping staff that they need to be particularly careful about that. We have sharps containers for any sharps that would be around the facility. Make sure that if you are working with a resident for some reason and they're starting to do their own blood sugars or insulin injections, that kind of thing, that they're using a sharps container. We never want any, of course, sharps around because they're very, very dangerous for staff and residents and everyone alike. In terms of laundry, again, biohazardous laundry would be any sort of laundry that's blood soaked also, and that would need to go into a red bag, and then it can go into the regular laundry. It's just that the red bag signifies to our laundry staff that there's blood soaked materials within that bag. Another area that is a protection mechanism and part of the bloodborne pathogen standard is that as an organization we offer the hepatitis B vaccination and post-exposure evaluation. And the hepatitis B vaccination is available through all of our infection control areas within our skilled nursing facilities, and or you can go to a physician and have that series yourself. You have to work out with therapy about that depending on where you're working. We have it available. It's available anytime. When you go into orientation, you will receive information about the hepatitis B vaccine and how to go ahead and get that if you'd like it. It's a vaccine, it's a series of 3 injections. You get 1 injection. Between 1 and 3 months, you get the second injection, and in 6 months, you get the third injection. Then there's a follow-up titer that's done to ensure that that vaccine is actually working within your body. The hepatitis B vaccine is a little bit different than a lot of other vaccines in the sense that it doesn't work for all people. And so we do this post-vaccination titer to see whether it's worked within you, and then if it hasn't, that there is a follow-up booster series that you can get. Having that hepatitis B vaccine is a great thing because it can protect you from bloodborne pathogens should you have an exposure. If you don't want the hepatitis B vaccine, or if you've had the hepatitis B vaccine at another employer's, there's a declination that you can go ahead and sign. If you've already had the vaccine, you should write down the dates that you've had it. That way, if there is an exposure incident, that the physician involved can take a look at that and evaluate what you might need as a result. If you have any problems with vaccines, we recommend that you talk to your attending physician to see about having that vaccine, to make sure that the actual hepatitis B component and then all of the components that they use to mix that are okay for you and your health. If you have an exposure, and again, as I said in the beginning of this, an exposure is an incident where there's blood and bodily fluids somehow that you've gotten into some orifice of your skin. Most often a needle stick injury, but it can be anything. Say you've had a cut on your hand, a resident falls, you go to help them, there's blood involved and you didn't have a chance to get gloves, and there was blood on your hand where that cut was, that would be an exposure. In the case that that happens, it's really important to stop, of course, make sure that the resident is okay, wash your hands, and go ahead and get follow-up. Report this to your infection control practitioner within the facility that you're working in, or you're certainly welcome to call me. And we have a whole series of things that we go ahead and do. There's an incident report, and then we'll go ahead and send you to our occupational health, who are very well trained in post-exposure, and will walk you through the things that we need to do. Most often what happens is that we ask whatever blood that, if we know the source of the blood, we ask that resident client, or however you got that exposure, we ask them to actually test their blood so we can check them for any bloodborne pathogens. If we don't know where the blood came from, then we treat you as not knowing, so we treat you as in kind of in a different category to make sure that you're well taken care of in case there was an exposure. Going to occupational health is really going to help walk you through to make sure that you are okay, and if there was an exposure to an actual bloodborne pathogen, that it's determined that you get the medications and the follow-up that you need. It's really, really, really important. I think one of the hardest things actually is reporting that you've had an exposure. It's a kind of a strange feeling. You kind of feel like you've done something wrong. What's most important that you take that step and go ahead and let us know so that we can get the incident reports filled out, get you to occupational health for that follow-up that you need. And if you want to talk about that or have any needs to talk about that, feel free to talk to anybody in therapy, or you can certainly call me myself. In terms of communication of hazards, that's also another important thing, because as you have exposure to bloodborne pathogens, there's some area where there's more hazard than others. And so we have a hazard label, and on this on these sheets you can see what that looks like. It's kind of 3 circles together and usually red in color. And we would put that biohazard sign on anything that would be potentially hazardous. It would be on a refrigerator if we were holding any sort of specimens or blood products in it. It would be on a biohazard can. It would be on hazardous waste out in some of our garages. Those are where those would be at this particular point. In terms of training, of course you're receiving bloodborne pathogen training right now. If we would have anything new, a new procedure, a new product, you would get trained on that. And then annually we train on bloodborne pathogens, just because it's just a really, really important thing. We want to make sure that everybody is very safe in the work that they do and in the environment that they work in. And it covers all of these same components. In terms of record keeping, we do record. We have to document all of the training that we do. We need to document all of the offers of the hepatitis B vaccine, all of the declinations, and all of those records are kept in our human resource, our personnel file. Periodically, OSHA inspectors come in to check our training, and so with that we want to make sure that we have everything in place. Most importantly, we want to make sure that you have the information that you need to work very safely in the environment. So far, one of the questions that I get asked the most is, what about the hepatitis B vaccine? I had this hepatitis B vaccine 15 years ago or 20 years ago. Is it still good? And so far, OSHA has made no recommendation for any sort of boosters for that vaccine. Initially there was a lot of different products that were used. For us that had it many years ago, we had it and we should just move forward. If there's any change in that bloodborne pathogen standard with that, we'll let you know. Today, a lot of kids already have the hepatitis B vaccine. They're getting it as a part of their regular vaccination series, so that's good. It's just some of us that didn't get that, that were born after the hepatitis B vaccine was developed, that we want to make sure that we're vaccinated if we can receive a vaccination. If you have any questions about the bloodborne pathogen standard, feel free to call me. Feel free to talk to anyone in therapy. And I hope you have a good day.
Right. Awesome.